Hello everyone. In today's video, we would be discussing about the anatomy of the cubital fossa. Cubitus in Latin, it means elbow. It is a triangular hollow space which is present in front of the elbow. So, because it's a triangular space, it would have boundaries, that is a lateral boundary, a medial boundary, a base and an apex. Medial boundary is towards the medial epicondyle side and lateral boundary is towards the lateral epicondyle side. This is the lower end of the humerus, this is upper end of radius and upper end of ulna. So the lateral boundary is formed by medial border of the brachioradialis muscle. The medial boundary is formed by the lateral border of the pronator teres muscle. The apex, which is directed downwards, is formed by the meeting point of brachioradialis and pronator teres, that is the lateral and the medial boundaries. The base is directed upwards and it is formed by an imaginary line joining the two epicondyles of the humerus. Now this triangle has a roof, it has a floor and it has got contents inside it. So the roof of this triangle is formed. The first layer of the roof is the skin, the second layer is the superficial fascia. The superficial fascia consists of veins. It consists of median cubital vein which is formed by joining of the cephalic and the basalic veins. And along these cephalic and basalic veins, you can see there are nerves running parallel to these veins. So because basalic vein is towards the medial epicondyle side, so the nerve running down is the medial cutaneous nerve of the forearm. And cephalic is towards the lateral epicondyle side, so the nerve running down is the lateral cutaneous nerve of the forearm. Below the skin, below the superficial fascia is the deep fascia which is covering the muscles, and also the bicipital aponeurosis which we have already discussed in our video on muscles of arm. So you have in the roof there is median cubital vein, there is medial cutaneous nerve of the forearm and there is lateral cutaneous nerve of the forearm. The floor of this triangle is formed by two muscles, that is brachialis, muscle of front of arm, and supinator. Brachialis is coming from the humerus to ulna for getting inserted, and supinator is going from the upper part of ulna to the upper part of the radius for insertion, and these two muscles are at such location that they form the floor of the cubital fossa. So this space is a very narrow space, so in order to see the contents properly, the muscles, the boundaries, they need to be retracted. So after retraction, we see the contents. That is, we start from the medial side, from the medial epicondyle, and will move towards the lateral epicondyle. So the most medial content is the median nerve. So median nerve supplies the muscles of the front of forearm, that is the flexor compartment muscles, the superficial muscles of the flexor compartment, that is flexor carpi radialis, palmaris longus and flexor digitorum superficialis. They are supplied directly from the median nerve, and this nerve will leave this fossa, will leave this space by passing between the two heads of the pronator teres muscle. The pronator teres has a deep head and it has a superficial head. Next content, next to the median nerve, is the artery that you see here. This artery is coming from above. It is coming from the axillary artery. This is the brachial artery which is coming, terminating at the cubital fossa, and it is giving two branches, that is the radial artery and the ulnar artery. So the radial artery is a much superficial and a smaller artery as compared to the ulnar artery. It gives one branch at the level of cubital fossa which is known as radial recurrent artery. So the difference between recurrent and collateral, recurrent branch will always run in the opposite direction from the main artery, and collaterals, they run in the same direction as their main artery. So if you see here, this branch of the radial artery is going up while the radial artery is going down in the forearm. So this is known as radial recurrent branch of the radial artery. Ulnar artery, it is a much deeper artery. It is present below the deep head of the pronator teres. So if you see here in this figure, this is the median nerve, this is the ulnar artery. So above the median nerve, there is the superficial head of the pronator teres. Below the median nerve, there is the deep head of the pronator teres. And below the deep head of pronator teres, there is the ulnar artery. Ulnar artery also gives various branches in the level of the cubital fossa. That is, two recurrent branches you see here, anterior ulnar recurrent, posterior ulnar recurrent. And it gives a common introitious branch to the introitious membrane. This common introitious further divides into anterior introitious artery and posterior introitious. And posterior introitious finally divides into introitious recurrent. So all these branches, that is anterior ulnar recurrent, posterior ulnar recurrent, common introitious divides into anterior introitious and posterior introitious, and posterior introitious divides or gives introitious recurrent branch. All these branches are branches of the ulnar artery at the level of the cubital fossa. Next content next to the artery you see here is the biceps muscle coming from the front of forearm. You see the tendon is going deep inside this fossa, forms the content, and you also see here is the bicipital aponeurosis, which is also the content of the cubital fossa. Next to the tendon, there is the radial nerve, which is the most lateral content of this cubital fossa. This radial nerve is coming from back of the arm. It is coming front at the level of lateral epicondyle. It is present between the brachialis medially and the extensor carpi radialis longus and brachioradialis laterally. So these are the brachioradialis and extensor carpi radialis longus muscles which are attached to the lateral side of the humerus. And this nerve supplies these three muscles. And at the level below the lateral epicondyle, this nerve gives off a branch which is known as the posterior introitious nerve or the deep branch of the radial nerve. It leaves this cubital fossa by piercing the supinator muscle. The floor of the cubital fossa pierces and passes out of the fossa. Finally, the clinical conditions, the clinicals of the cubital fossa. There are two very important structures. That is the median cubital vein, which is vein of choice for intravenous injections. And there is the brachial artery, which is the artery for recording the blood pressure auscultated in the front of elbow at the level of cubital fossa. And this portion is also liable for the fractures, the supracondylar fractures, which are fractures around the elbow at the lower end of the humerus. So they have a complete different clinical anatomy which we would be discussing in the videos related with the applied aspects of the humerus bone. So this is it for now. Please do like, share, comment and subscribe to the channel. Press the bell icon for more updates related with anatomy and more updates related with medical knowledge. Thank you so much.